Welcome to Cancer Answers. The answers start here. I'm Linda DeWitt. Our topic today is lung cancer. November is Lung Cancer Awareness Month. Joining me is Dr. Jack Wei, a radiation oncologist with Community Health Network and an MD Anderson Cancer Network certified physician. Welcome.
Thanks.
I wanted to talk to you about lung cancer, how common it is. We'll start with that. And do you see a large volume of patients with the disease right here in central Indiana?
Yeah, lung cancer is one of the most common cancers. It's the number one cancer killer for both men and women in this country. Nationally, there's about 150,000 cases per year, and here in Indiana, we see about 5,000 cases annually of lung cancer.
Dr. Wei, who is at risk for lung cancer? This isn't something that the general population is at risk for, right?
Yeah, I mean, clearly the highest risk factor for lung cancer is smoking, and that's been that way for decades now. Fortunately, we're seeing that number decrease as less and less people are smoking, but still smoking is the number one cause of lung cancer. There are some other factors related to that are less common: radon exposure, asbestos, some other things like that. There's a genetic factor, but still primarily smoking is the primary cause of lung cancer.
The big one. And then also, what about secondhand smoke?
Yeah, so secondhand smoke does increase your risk of lung cancer, not as much as you would see if you were the primary smoker, but it's clear that patients who have regular secondhand smoke exposure are also at increased risk for lung cancer development.
And is it mostly lung cancer? Does it normally target somebody who is a heavier smoker, for example, X amount of packs a day, or is it somebody who might be a very light smoker?
Yeah, I mean, even if you're a light smoker, you're still at risk, but it is dose related, so your risk of developing lung cancer goes up the more you smoke. After you've stopped smoking for a certain period of time, your risk significantly decreases, but that can be 15, 20 years before you really see a significant decrease in the risk of lung cancer development.
And also, there isn't just one type of lung cancer, right? There are, how many different types? What are they?
Well, there's a number of different types. There's two broad categories that are by far the most common that we see in the clinic, and that's going to be non-small cell lung cancer, which is the most common type, and small cell lung cancer. There are some less common types like mesothelioma and some other types, but primarily non-small cell lung cancer and small cell lung cancer are the ones that we see.
Okay. What are the symptoms in general? So if a person is a smoker, what should they be looking for? Or even if you take in secondhand smoke, what are the general, more typical symptoms? Yeah,
so most patients, if you're coming in and you're diagnosed, a lot of times you're presenting with cough, shortness of breath. Depending on the location, if the cancer is more in the center of the chest, sometimes you can get some bleeding, coughing up blood. If it's more towards the outside and irritating the lining of the lung, you can get some chest pain, rib pain associated with that. And then the other way that we see a lot of patients present is, unfortunately, lung cancer frequently is diagnosed when the cancer is already spread beyond where it started. And so symptoms related to where it initially came from, if it's spread to the brain, you get neurologic symptoms, or somewhere else, you'll see symptoms related to wherever the cancer happened to spread to.
So early diagnosis is key?
Yes, and it's clear that the earlier you diagnose it, the more successful we are at treating these cancers.
So should people get screened for lung cancer, and who would that be? What are the screening guidelines?
Yeah, so within the past year and a half, they came out with some general recommendations for screening of lung cancer. The recent studies have clearly shown that if you're going to screen for lung cancer, the best screening tool is actually a low-dose CAT scan as opposed to a chest X-ray. It's more successful in terms of picking up cancers. And the national recommendations for lung cancer screening would include current or former smokers, and former smokers being patients who have smoked within the past 15 years, at least 30 pack years of smoking, which is the pack years are determined by the number of years you smoked times the number of packs you smoke per day. So someone, for example, who smokes a pack per day for 30 years would be a 30 pack year smoker, and between the ages of 55 and 74.
Okay. How is cancer that has spread to the lungs perhaps treated differently than cancer that originates in the lungs?
Right. So that's often a misconception in terms of whether you have lung cancer or not. So lung cancer means a cancer that actually started in the lungs, that the cancer cells come from lung cells that have mutated and now are starting in the lung. lung is also a common site for other cancers to spread to. And so when you see cancer that's spread from another site to the lungs, that's not lung cancer. That's actually whatever that cancer was that's metastasized to the lung. And generally, the general principle when you treat cancer that's metastasized is you treat it like the cancer that it came from. So if you had a breast cancer that's spread to the lungs, you still treat it with the same sort of chemotherapy agents and with a lot of the same principles that you would treat breast cancer with. As opposed to a lung cancer, which originates there, you'll treat it with specific lung cancer treatment regimens.
Which, again, now moving into the treatment part of this, so if a person is diagnosed, what can they expect as far as treatment is concerned?
Right. So usually the first question we have to ask is the cancer spread anywhere beyond where it started in the lung itself? And if it's still in the lymph nodes of the lung, generally that's still considered contained within the lung itself, either in the lung or the lymph nodes of the lung. If it's spread outside of the lung, then the general treatment principle at that point becomes chemotherapy, because you need some sort of treatment that goes throughout the body and is going to treat all the cancer no matter where it's at. That's the general principle. If the cancer is located and confined to the lung itself, then you have to see whether or not the patients are surgical candidates or not. Patients who can go through surgery, generally our success rate in terms of treating those patients are better if they can go through surgery. If they're not surgical candidates, then oftentimes they'll get treated with radiation alone or in combination with chemotherapy.
What are some of the tips? Obviously, cancer is a very devastating disease. It's a devastating diagnosis for anyone to receive. What about families and how they can all cope? Do you have any tips as a physician as far as what you've seen when you treat patients, and any advice you would offer patients and their families?
Yeah, absolutely. I mean, first and foremost, we know that patients who, because smoking is a primary cause of lung cancer, patients who continue to smoke through treatment don't do as well. Their response to treatment is not as good as patients who continue to smoke. And so it is very helpful if families can encourage patients and participate in smoking cessation. It's very difficult if your spouse continues to smoke while you're trying to quit to quit yourself. And so to join in that effort in terms of, smoking cessation is very important. There's a lot of social support that you can give. Going through treatment for lung cancer is oftentimes difficult. You can get a lot of side effects from treatment, whether that's from the surgery or chemotherapy or radiation. And so just having that support to drive you back and forth from to treatments and be there when you're not feeling well and you're nauseous or whatever that might be is very helpful from a family perspective.
If a person stops smoking, given that smoking is the number one risk factor for lung cancer, there is good news. If they stop smoking, they can decrease the risk. How does that work? Yeah, so your lifetime risk of developing a lung cancer does go down the further you are out from smoking, but it takes a number of years. And so by the time you're 20, 25, 30 years out from your smoking, your risk of developing a lung cancer is starting to approach the risk of the general population, non-smoking population. But you got to take that first step where you actually stop smoking, and then you just need the time from that point on in order to reduce your risk. Last year, community hospitals east and north here in Indianapolis became affiliated with the MD Anderson Cancer Network in Houston. And that's, of course, a world-renowned cancer center that selected Community as its first exclusive local affiliate. How does this affiliation benefit lung cancer patients? And if a patient chooses Community as the place to receive his or her care, how would you or the doctor treating them interact with MD Anderson cancer physicians in Houston?
Absolutely. So there's, this MD Anderson affiliation has been fantastic for cancer care here at a community hospital. There's really two layers that we work with MD Anderson. The first is a general oversight where we have the number one rated cancer institute in the country, where they routinely look over our treatment care plans and make sure that we're following standard care and the most up-to-date information in terms of how we're treating patients. And so there's an oversight aspect to that directly impacts patients here that we are treating. And as with any cancer, occasionally you get to a point where treatment decisions are difficult. The path is not clear, and so we have direct access to either interact with those physicians where we can call them up, talk to them, present cases. They'll actually look over the films, the pathology, and everything that we can send to them and give us their recommendations based off of their vast experience as to how to treat patients. But also we can facilitate direct referrals down to MD Anderson if you're looking for a clinical trial or some specialized treatment that's just unfortunately not available here in Indiana. We can facilitate that sort of interaction as well. So there's a lot of different layers that we interact that benefits the patients directly.
Dr. Jack Wei is a radiation oncologist with Community Health Network and also an MD Anderson Cancer Network certified physician. Thank you for joining the program today to shine a very important light on lung cancer.
Thank you.
For more information about Community's collaboration with the MD Anderson Cancer Network, visit ecommunity.com/cancercare. The answers start here.